Physician-assisted suicide was first legalized by the state of Oregon in 1994. While it took 14 years before a second state legalized assisted suicide, its supporters, who refer to the practice as death with dignity, aid in dying, or end-of-life options, have advanced more than 200 legislative initiatives in 36 states since 1994. As of July 2018, physician-assisted suicide has been legalized in 7 states and the District of Columbia. The legislation being proposed is nearly identical in each state and is part of an organized drive by Compassion and Choices, a heavily funded special interest group. They claim it would enable terminally ill patients to ease their pain and have more control over the end of their lives. Unfortunately, nothing, from the group's name to the promises of decreased suffering and more autonomy, are what they seem.
The euthanasia movement, modern euthanasia movement, really dates back to Derek Humphrey in the 1970s and to Dr. Kevorkian in the 1980s and 90s, and they at least were clear about what they were doing. And when proponents are clear about what they're doing, the public largely rejects them.
I've been doing this work since 1993 because a friend of mine committed suicide under the influence of the Hemlock Society literature. And I got a suicide note in the mail. It just said Francis on the return address. And she talked in this very bizarre language in this note about her deliverance and how this was her final passage. And I was thinking, something's wrong here. To show you the mindset of people who promote assisted suicide, it was filled with Hemlock quarterly newsletters. These letters also had the list of drugs that could be taken to commit suicide with a toxicity 1 to 5, and also had a description of how to use a plastic bag over your head to make sure you die. Francis underscored it completely in yellow. Francis committed suicide by taking an overdose of drugs in a hotel room and having a plastic bag put over her head. The Hemlock Society is now called Compassion and Choices. They changed their name into a euphemism.
Just euthanasia societies, the Hemlock Society, etc., that doesn't market well. And so what the movement has done is they've developed much more palatable and euphemistic ways of presenting what they've been presenting for many, many decades.
And it strikes me that any movement that can't be clear and accurate in the language it's using, that must use euphemisms to try to mask the hardness of what they're discussing, the coldness of what they're discussing, is a movement that people shouldn't trust.
What is really involved in committing assisted suicide?
Someone has a prescription and prescribed, it's delivered to the pharmacy. That prescription involves 90 to 100 capsules of secobarbital. It is intended to be taken all at once, not the 1 capsule per night that people use to help them go to sleep at night and help them sleep better. This is all at once. It's an overdose and it's a poison. But what has to happen before anything else happens is that you also need a prescription for an anti-nausea medication, because you're taking a poison and your body's natural response to a poison is to vomit it up. So you have to suppress that natural response of your body to rid yourself of this poison.
There should be no confusion among the public that this is medical care. When you use a medication for a medicinal purpose, then it's appropriate to call it a medication. But when you use a drug to kill people, then the only appropriate term is a poison.
If someone doesn't die right away, they could be having seizures, they could be in a coma situation, they could have trouble breathing, respiratory depression. Ideally, you die within 5 minutes. But Oregon has the data, and there are people who have taken days to die. Somebody took over 4 days to die.
And if you read the bill, it calls it medications over and over and over again. I think that if one took the bill that's being proposed in the Maryland legislature and crossed out the word medication, and everywhere where that word appears substitute the word poison, I think it would be very hard for any legislator to support it.
Supporters of the bill say patients need this option to die early so they don't have to endure extreme pain. But the truth is,
pain can be controlled in any amount with any illness. We have very powerful pain medications. We have distracting techniques and other alternative techniques that can be used for pain as well.
And so people should not feel that they have to choose this in order to get relief of pain. Pain management has really made enormous strides in the last few decades in palliative care and hospice care. There is actually now a whole field of medicine that's dedicated to pain management. That didn't even exist when I started out.
Why do people ask for assisted suicide in the first place? It's not pain. It's not pain. It's fear. It's loneliness. It's feeling like a burden. It's demoralization. They are disconnected. They feel worthless. They feel isolated. No light at the end of the tunnel.
the following statistics are from Oregon listing the main reasons to ask for suicide. Number 1, losing autonomy, 92%. Number 2, less able to engage in activities making life enjoyable, 90%. Loss of dignity, 79%. Burden to others, 41%.
I think people choosing death because they're afraid of things that happen to them at the end of their lives, like losing their autonomy, not being able to bathe themselves and needing help in going to the bathroom. I think that they're not talking to the right people, and they're listening to people who assume that that's a terrible life. And I'm here to tell you, as a disabled man, it's not a terrible life. The idea that having a high quality of life is the only way to exist, that's really incredibly judgmental. Who are you to say that my quality of life is any worse than your own just because I have to use a wheelchair or I need help with bathing, etc. And then to have people say that we're going to make this law and make it easier for you to not be disabled, that's insulting. And it's scary.
One of the top reasons that people choose is because they don't want to feel as though they are a burden. And another one is feeling that they don't enjoy anything or can't get enjoyment out of life. Something like 90 to 95% of patients select that as at least one of the reasons. And that to me is troubling because that's a cardinal symptom of depression. And yet less than 5% of people in Oregon are referred for formal psychiatric evaluation prior to choosing assisted suicide. So there's a big disconnect there between the symptoms and the concern that people are expressing and the way that physicians prescribing assisted suicide are responding.
Most people, as they approach death, I think have feelings of depression, anxiety, fear, a lot of sense of loss. There's a lot of emotions going on as they approach death. And as a nurse practitioner for over 30 years, I've only had a handful of people actually tell me that they wanted to take their own lives. So when I referred them for counseling, it was tremendously effective. Those thoughts, just went away.
The proposed Maryland legislation is virtually identical to the laws that have been passed in Oregon, Washington, Vermont, and California. To qualify for the lethal prescription, a patient must be free from coercion, of sound mind with no signs of dementia or depression, and have a terminal illness with less than 6 months to live. But these criteria are very hard to predict.
So take the provision that a patient should have a 6-month prognosis. Physicians don't really have ability to predict when somebody has 6 months left to live. And in fact, that's not something that I've ever said to a patient in my life in the 20 years that I've been involved in medicine. I would never presume to give a patient a time period.
My father-in-law actually had that happen to him. In 1997, he was diagnosed with pancreatic cancer, and he was given 6 months to live at that time. He was told that it had spread to his liver, and we got a second opinion on that and found out that it actually had not spread to his liver, and he could qualify for what was called a Whipple procedure. It paid off because he lived 10 more years cancer-free. And at the time when he became sick, we only had one child, and we had 2 more children, and they all got to know Papa. They all got to know who he was. And he was very much a part of our daily life. He came over almost every day and spent time with the kids.
The bill is supposed to have safeguards against abuse, but they are not effective.
All of the safeguards of the bill are really an illusion, because if you look at each one of them, they're really unenforceable. A significant percentage of patients outlive their 6-month prognosis after getting their lethal prescription, and yet there's no consequences for the physicians who wrote the prescription. And what that functionally means is that that provision of the law is unenforceable. Another very troublesome aspect of the law is that it gives immunity to physicians in prescribing assisted suicide. And what that means is if there's immunity, then there's no accountability. It means that every kind of mistake could be made in making a diagnosis, giving a prognosis, writing the prescription for the drugs, giving instructions. Every aspect of it could be done wrong, and a patient could die a painful and wrongful death, and yet there would be no consequences for the physician at all.
The bill requires witnesses, some of whom can be benefactors of the estate, to be present when the patient files their request for physician-assisted suicide. But there are no requirements for any witnesses at the time of death, making coercion a serious concern.
If you assume that a physician could know at the time of prescription that a patient is not depressed, that a patient is not under any coercion or any undue influence, with no witness at the time that the drugs are consumed, there's no way to know if a patient is depressed or coerced or under undue influence at the time that the drugs are taken.
But you know, real coercion happens behind closed doors. People don't go to doctors and show mom with a black eye. That's not how it happens. It happens subtly. It happens with saying, for example, well, if you want the pills, Mom, maybe you should take them. What message does that tell Mom?
It's often said that in states that have assisted suicide that there's very little or no reports of abuse. And the reason for that is because it's virtually impossible to investigate or hold anyone accountable for when abuse occurs.
This bill puts large quantities of barbiturates in people's homes. In Oregon, due to the uncontrolled nature of the assisted suicide process, there are cases where the drugs are unaccounted for. The bill's supporters claim federal laws controlling Class 1 drugs will prevent their misuse, but it is unlikely that law enforcement officials struggling to contain the opioid crisis will be able to track yet another class of deadly drugs.
We already have a huge diversion problem, as we know, with opiates. Now we want to add to that problem by adding barbiturates to that category. But barbiturates are a controlled substance. They're controlled because they have a high abuse potential. That's the reason that they're a controlled substance and that there are laws and regulations for them. So we want to have more of those out there. 1/3 of the patients in Oregon never use the prescription.
And then to offer somebody such a dangerous prescription that could fall into the wrong hands, not be well accounted for, it just goes against everything we're trying to do with health today.
One of the other problems is that there's no requirement as to who is going to pick up the prescription. So the patient doesn't have to pick it up. Someone else can pick up the prescription. So you're standing in line to pick up your medication to help you live, and someone else is standing in line to pick up a prescription to help them die or to help someone they know die. There is no accountability. Once it's dispensed, no one knows where it goes. No one knows what happens to it.
In the name of patient autonomy, the bill allows patients to commit assisted suicide without notifying anybody in their family they are planning to commit medically assisted suicide.
I'm concerned that there's no provision for the family to be notified.
When I went back to my office, there was a young lady sitting in my office, and I asked her why she was there. And she didn't know anything about me, and I didn't know anything about her. And she began to explain to me about some friends of hers who had been looking for their mother and father. And she says, you know, she called her mother and father daily, and this particular day they could not reach them. So the daughter went to the house and opened the door and found a note. Well, the mother and father had left a note just telling the daughter where they could be located at a hotel in Arlington. Upon arriving at the hotel, the most shocking scene she could witness was that her mother and father lied in the bed, dead.
Yeah, I found in my experience, my patients utilize their family and close friends, significant others, for help with decision making when they have, you know, big decisions to make about their health. And with this bill, the person keeps it to themselves, doesn't talk with their family about it. They're maybe embarrassed, they're feeling like they're a burden, so they just keep it to themselves.
But I looked at the pain on the friend's face, from the pain that her friend suffered when she witnessed this. And it was unbelievable, but she said the parents left in the note that we did not want our children to bear any kind of responsibility of trying to prolong our lives. We feel that it would be much easier for you if we did it this way.
Time with family is very precious as someone nears death, and they may feel like they're a burden, but in my experience, families do not feel that person's a burden at all. They cherish their time with that person, and most families would just be devastated if they didn't know that this person was thinking about ending their life.
In addition to having weak safeguards against abuse, many people worry that the assisted suicide bill will rapidly expand beyond being just for the terminally ill.
But once you accept the premise that suicide or killing is an acceptable answer to the problems associated with human suffering caused by illness or disability, it's going to expand. How can it not expand? We are a logical species. We take our ideas and our first principles where they lead us.
This whole philosophy of better dead than disabled, it's something that's pervasive in society.
Well, the things that cause people to want to commit assisted suicide if they have a terminal illness can also be true of people with disabilities, or can also be true with people with serious chronic diseases. There are a lot of people who suffer far longer and far more intensely than people with terminal illnesses.
To see a group of people saying, well, we want to pass a law because nobody should be like I am, and then that's insulting and scary. Because most people who are dying, they are disabled. So from that perspective, they're telling me they'd rather be dead than be like I am.
It's discriminating against people on the basis of a disability. It's very hard to see how it will stand up to scrutiny, either from an Americans with Disabilities Act challenge or a 14th Amendment equal protection challenge.
If assisted suicide is turned into a medical treatment, what medical treatment has ever been able to be restricted to a small category of people? How are you going to keep a medical treatment restricted to people with only 6 months left to live?
For thousands of years, physicians have followed the Hippocratic Oath, which prevents healers from administering poisons. If physician-assisted suicide is legalized, it will profoundly affect the way we interact with our doctors.
The other important point to make is that this is really going to affect the mentality and the way doctors and healthcare providers approach patients with advanced and so-called terminal illnesses. It's going to change the way of thinking, particularly if this is taught to medical students and residents as a quote-unquote normal part of medical care.
It's very easy for me to tell a patient that, oh, your case is hopeless, and guide you to ask for physician-assisted suicide, because the way I communicate with my patient is going to be critical. This procedure is offered in many places and will be offered more and more as an option among other treatment options. So you can do this, you can do that, or you can go for suicide. So, you know, a very positive doctor will guide you towards treatment, and a negative doctor will guide you, scare you to ask for a physician. So the way we handle, the way we communicate with the patients, it's critical on how people are going to decide.
The concern is that doctors will become more callous towards their patients, less caring, especially patients who might be facing death.
Proponents say this law gives people more control over how they die, but there have been cases in California and Oregon where people's insurance companies have denied their prescribed treatments and offered assisted suicide as an alternative. Assisted suicide advocate Derek Humphrey wrote about this unspoken argument in his book, The Right to Die. He said, in attempting to answer the question, why now? One must look at the realities of the increasing cost of health care in an aging society. And because in the final analysis, economics, not the quest for broadened personal liberties or increased autonomy, will drive assisted suicide to the plateau of acceptable practice.
I think there's a problem that people don't like to talk about, but they need to think about. And that is assisted suicide as a means of cost control in medicine. It might cost $2,000, $3,000 for an assisted suicide, including the doctor visits. It might cost $200,000 or $300,000 in interventions to make it so somebody doesn't want assisted suicide. The economic force of gravity of assisted suicide becomes very clear. And so you can begin to see the idea of assisted suicide as a method of keeping costs down.
Perhaps the most dangerous side effect of honoring someone's personal autonomy so that they can choose this for their own selves is the potential to deny ourselves life-saving treatment. If insurance companies start denying coverage for our treatments, then that really doesn't give us a choice on how we're going to die.
There's a lot of focus in our healthcare system now about reducing costs. It's a major focus. And unfortunately, assisted suicide and euthanasia is always going to be the least expensive option.
What does real compassion look like?
The assisted suicide movement has done something that I think is quite insidious. They have co-opted the word compassion as if giving an overdose of poison, because that's what we're talking about, is somehow compassionate. But compassion, the root meaning of compassion, means to suffer with. Compassion means that you take the time and effort to even cause yourself suffering by helping the other person overcome suffering.
Number one is we don't know the value of our own lives. About 20 years ago, I worked with a group from my church in providing some adult daycare for one of the members of our congregation. His name was Dave, and he had muscular dystrophy, and his condition had deteriorated, so he couldn't take care of his personal needs any longer. And we, for a couple of years, went in, took turns going in every day at lunchtime for about an hour. We fed him lunch and read articles to him and emptied his catheter bag. And it was a really positive experience for those of us that helped him. And those lessons went beyond our little group. We taught them to our children and our friends. And Dave has no idea that his life at the end was a valuable thing for the rest of us.
We need to make people believe that their life is worth living, that they can have good days, they can have meaningful interactions. There's nothing compassionate about this. Compassion is caring for people, showing people that they are loved and will be cared for when they can't care for themselves, when they're suffering, and that they can get relief from that suffering. And the healthcare community should be doing that.
But by legalizing assisted suicide, we would be forcing people to question the value of their life at the most vulnerable point in their lives. No law to promote the personal autonomy of a few people can be good if it victimizes the weak and the vulnerable.
What this bill does is it doesn't really create a new right. Suicide is not technically illegal. It's assisting a suicide that's illegal. And if you think about it, the reasons for making assisted suicide in general illegal is that society recognizes that human life has great value, and that in any situation of assisting a suicide, there's a terrible potential for abuse. So think about what's happening here. What we're doing is we're actually taking a class of people who are defined by having an advanced illness or a disability and saying, we're not going to allow the protection of the law for you.
You know, I have multiple sclerosis, and I despise the thought of being dependent like Dave was. My kids are great, my family loves me, but I worry that they might resent caring for me if it goes on a long time. I hope I'll choose not to do that, but I don't know. When you're depressed and in a mental condition that's not stable, I'm not sure what will happen. And even as strongly as I feel about it now, it helps me see that this is a real risk for many people.
If this method was legalized, I think people would start to look at it as a norm, that this is what they're supposed to do. We normally wouldn't think of it as suicide being socially acceptable, but suddenly it's legalized, and it may seem desirable to some people to end a burden, be less care, and they may do it when they really don't want to.
No one wants to be a burden. No one wants to spend money on their long-term care, and take that money from their family. No one wants the things that happen when you're very ill at the end of your life. But if the state gives us the means and the moral approval to end our own lives unnaturally, it makes us feel guilty for clinging on to life, I think.
Well, the whole question of what is a free choice in this kind of situation, and it is natural for patients who are elderly, who have disabilities, who have advanced illnesses, to feel like they could be a burden. And having this law is just going to accelerate and accentuate that problem and that danger of people wanting to take this option to feel like they're relieving others of a burden.
As I looked at this law, that was the first thing that came to my mind. Oh, if it's legal, then it's going to feel even worse. I'm going to feel even more selfish.
One of the dangers of allowing laws like this to pass is that what is now deemed to be a choice, or advertised as a choice, gradually becomes an expectation. And I think that's one of the reasons why bills like this have to be stopped.